Hey everyone, it's Dr. Rick with Hoffman Estates Integrative Medicine, and I'm just setting my timer. This is my Garmin that I take people to national parks with, but there is a stopwatch option, and I think most of your phones will have the same thing. So I'm setting it for 10 minutes. I was going to go work out this morning. It's Sunday, and I have a lecture later on to attend, but on the way to Planet Fitness in Bloomingdale, the sun came out and blinded me, which obviously it's cold out in Chicago right now. I think it's like 40 something. But the reason I wanted to do this quick tutorial was if you're going to be going through, if you live at a latitude that's equal to Chicago and you're going to be going through winter, there's going to be the cloud of depression that hits that season. Seasonal affective disorder is definitely a diagnosis that we make in the office, oftentimes with people who have mild depression or minimal depression. Doesn't show up until wintertime. And then during wintertime, whether you want to blame the diagnosis, SAD, or you have the stress of holidays, the loss of a loved one, that anniversary, that death anniversary, or the stress of the new year. Or if you're a night shift worker and it's darker during the day, and definitely dark with the luminescent or the lights that are overhead, so you essentially don't see light. All those things are challenging. The medical community in the last 20 years has said sunscreen, block, wear clothing, shade, and I think that's fair. Melanoma is a definite threat for a lot of folks, but not everyone. And you have to look at the things that happen during the winter time and assume that if it's going to be challenging, get ahead of it. And this is what I'm talking about. This sun that I'm in now is working to give me therapy. I'm at the 2-minute mark now. So the sun has a full spectrum. It's a very healing thing. Obviously, the earth was made and humans were made on the earth due to the energy from the sun. The energy from the sun is translated into plants, and then you eat the plants and you survive. Or you eat the animals that eat the plants and you continue to survive, because that's the fuel that we need to run every cell in the body. If you don't have any energy, also known as ATP, this is going to be the Physics 101 or Anatomy 101. If you don't have any fuel, meaning plant or animal food, then you will die, because every cell in your body is required to produce ATP, adenosine triphosphate, and that's utilized as energy for every cell. Whether it's a nerve cell and producing electricity that gives you thought and mood, or it's a digestive cell and it makes digestive enzymes, it absorbs food, it keeps bad stuff out, or it's muscle and you have to move through locomotion and calcium bridges between actin and myosin filaments. It doesn't matter. Every system is based on energy. Every energy cell, which is called a mitochondria, will be able to produce what we need to get us till 100. The problem is sometimes things get in the way, and some things could be stress, overeating, not enough exercise. Those are all very common. And when you go through those things, the mitochondria suffers. If the mitochondria in all of your cells suffer, you can't think right, your mood goes downhill, you can't move, you have fatigue, you can't digest. So I just went through all the systems. And a lot of us will have a flare-up of those symptoms from those systems that go offline or are being challenged during the winter time. So if you can, get to your doctor or get to me if you're one of my patients, but prepare for winter. And that's with regards to your prescriptions and or your challenges and your medical problems. But one thing you can do on your own, which is free, is to get exposed to sun. I'm at the 4-minute mark. Sun will give you wavelengths of energy. Wavelengths of energy are either short wavelengths or long wavelengths. I just keep it at that. The rainbow that you see in colors, it's like the spectrum of what you get from the sun. And right now I'm getting full spectrum. Now I'm bundled up, but UV light, that's shortwave, that's one end, blue. UV light is getting to my eyes, and there's little things in the eyes called melanopsin ganglia. That's actually a nerve. And when the nerves experience UVB, then they get triggered to stimulate the spleen to squeeze and produce little macrophages, and these things are white cells that go around and look for infection, or they look for cancer. The UVB to the melanopsin ganglia also turn on the connection between the hypothalamus and the gonads. Gonads produce testosterone, they produce estrogen, progesterone, all important for being male or female or just having energy. So those of you who are lacking energy, it's important to be exposed. Maybe 10 minutes a day would be fine. Using sunglasses and blue blockers will stop that. So I think there's a place for blue blockers at night if you have to do work or you have to read anytime after the sun sets, then use the blue blockers. But during the day, no, let the sun come in. So that's the short wavelength. The opposite end of the rainbow, where you have red, that's infrared or near infrared, that's important also. And I don't want to get into too many details, but if you subscribe to my YouTube channel, I'll be talking about mitochondria and melatonin and energy. But infrared and near infrared will actually penetrate clothing. It'll penetrate the skin, at least go down about 1 inch to 2 inches in some areas of the world. And when it gets down that low, it stimulates cells. So let me just speak to people who have problems with hair or skin or puck marks from acne. When you stimulate via infrared, it gets down to deep dermis layers, stimulates or gives energy to those mitochondria, those cells that need energy, to produce stem cells. Stem cells are baby cells that give you youth, youthful skin, youthful sebum or proper oil secretions that you don't have acne, and then new hair cells. So it is important, even with covers, to stimulate those new cells to produce better looking skin, hair, and nails. Now that's just the aesthetic part, but there is benefit even in the form of the brain. So with a lot of people who have mood disorders or memory issues, cognitive impairment, Alzheimer's disease at its worst, in some cases those cells in the brain aren't able to produce any energy and they fail in their function. So you can't think as well, you don't remember stuff, you're really fatigued, you have no motivation, and or your mood disorder gets worse, whether it's anxiety or depression. So in some cases, the shortcut, and you really should seek a doctor to make sure that you don't have any other big medical diseases, but the shortcut that you can do on your own is expose. So the infrared, so we talked about UVB, short wave, infrared, long wave. The infrared, because it's long wave, can penetrate through clothing, can penetrate through hair, can penetrate through skin, and it gets down into what I mentioned, the basal layers, the dermis and the fat and the stem cells. It also can penetrate skull. So when it penetrates the skull, I don't know how else to describe it except for light. If you ever go to a doctor's office the old-fashioned way to figure out if you have a sinus infection, is you open your mouth, we put a light on your maxillary sinus, and we see if it's blocked up on one side compared to the other side. You can see a red flare. Try it yourself. Have somebody open their mouth, put a flashlight that's not hot on their maxillary area, and you can see the red coming through. That's really old school, but we used to be able to do that when there wasn't CT scans available, and if you didn't see the translucent red on one side versus another, you'd assume the one side that you did not see any red, or the light wasn't coming through beautifully, that was blocked up with pus. That was a sinus infection. Believe it or not, that was old school. Now we have CTs, MRIs, scopes, but that just goes to show you that a flashlight can penetrate through skull, bone. Well, infrared, long wavelengths can penetrate through, this is the theory, and it has been proven with randomized controlled trials. I'm not going to put them here, but the theory is that The infrared goes through the skin, goes through the skull, and then hits what's called the gray matter, the brain tissue. But between the skull and the brain tissue, we have fluid, cerebrospinal fluid, or CSF. And during COVID, it was proven that with several different teaching schools, medical schools throughout the world, and research facilities, that the infrared would bounce through, it would go through the skull, bounce into the CSF, the cerebrospinal fluid, get the top layers of the brain, but also the cerebral spinal fluid would carry the energy from the infrared wavelength into the deeper layers of what's called the gyri. If you've ever looked at a brain picture, you see these, it looks like jello, looks like there's little cracks and crevices, and the reason for that is you compress tissue and you can get fluid everywhere. Anyway, it was through animal studies, it was found that the infrared stimulation would stimulate not only the top layers of the brain, but deeper layers of the brain. That's through animal studies. You can't really do that with humans. So even to the point of penetrating skin, penetrating dermis, penetrating down to the blood vessel, the theory is that the infrared hits the blood vessels in the capillaries, and the capillaries carry that energy to different cells deeper inside the body, and you refresh the energy, the mitochondria, you refresh those and have them perform at better levels of functioning. If all the mitochondria in the body are functioning immediately and produce ATP through glycolysis and the Krebs cycle, or beta fat oxidation, those are the two types of metabolism that you can produce energy with: glucose or sugar, fat or beta fat oxidation. But when you are very, optimized with utilizing the fuel systems that you have in the mitochondria, you're youthful. You think faster, you perform muscle movement faster, you digest easier. Everything comes of age, and that's youthfulness. So I'll give you a summary that being exposed, it's now 12 minutes, so I'm finished, but being exposed to this kind of sun, even with clothing on, with my eyes being unshaded, should give me a little boost in testosterone, in dopamine, and in the way the mitochondria are going to perform for the rest of the day. So it should boost me. I'm hoping that if I continue this during the winter time and get into the spring, then it'll be hopefully an easier winter. So the one caveat, or not one caveat, but the one clue I will give you, technique, is not only should you have, I'm turning this off, it's 12 minutes. Not only should you have a watch or a timer, because everybody's busy, 10 minutes should be good enough. And just in case you have a lot of shaded area and you're in a forest preserve, near infrared and infrared bounces off of things like plants behind me, different objects that are natural. So if you want to maximize your time, get on the Weather Channel, look for your weekly forecast, see what the forecast is for the next day or two, and usually if you do an hourly evaluation or an hourly description of the weather patterns, it will either give you a cloud with raindrops, or the icon of a sun. And if you can figure out when the sun is going to peak during the next day or two, you can plan your day to either get out for lunch, get out before you leave for work. Again, 10 minutes is all I suggest. You can even get near infrared stimulation and maybe a little bit of UVB during overcast days too, but it's just so refreshing to get it this way. So hopefully this gave you a couple ideas. If you have any questions or comments on how you get your sun exposure, if you use a full spectrum lamp or infrared or near infrared lamp, please put them in the comments down below. If this helped you, great. If you have anybody that suffers from seasonal affective disorder, please share this with them. Otherwise, consider subscribing to the channel, give me a thumbs up, and I'll see you at the next video.